Hello everyone, my name is Patricia Roden and I am bringing to you my drug for my UWF Drug Monograph, Entresto, sacubitril valsartan. Entresto, sacubitril valsartan, is a registered trademark of Novartis AG. Entresto is available by prescription only. It is a pharmacological class angiotensin II receptor blocker or a neprilysin inhibitor. The FDA approved Entresto for heart failure July 7th of 2015. Generic name and formulation. Entresto is also known as sacubitril valsartan. The active ingredients are sacubitril and valsartan. Indications. Entresto is a prescription medicine used to reduce the risk of death and hospitalization in people with certain types of long-lasting chronic heart failure. Entresto is usually used with other heart failure therapies in place of an ACE inhibitor or other ARB therapy. Dosing. Adults Entresto is contraindicated with concomitant use of an angiotensin converting enzyme, which is an ACE inhibitor. If switching from an ACE inhibitor to Entresto, allow a washout period of 36 hours between administration of the two drugs. The recommended starting dose of Entresto is 49/51 milligrams twice daily. Double the dose of Entresto after 2 to 4 weeks to the target maintenance dose of 97/103 milligrams twice daily as tolerated by the patient. Children. Safety and effectiveness in pediatric patients have not been established for the use of Entresto. Contraindications. Do not use Entresto if you are allergic to sacubitril or valsartan or any of the other ingredients in Entresto. Do not use Entresto if you have had an allergic reaction including swelling of your lips, tongue, throat, angioedema, or trouble breathing while taking a type of medication called an angiotensin converting enzyme inhibitor or angiotensin II receptor blocker, an ARB. Take an ACE inhibitor medicine. Do not take Entresto for at least 36 hours before or after you take an ACE inhibitor medicine. Talk with your doctor or pharmacist before taking Entresto if you are not sure if you could take an ACE inhibitor. Do not take Entresto if you have diabetes or take a medicine that contains allocersin. DC when pregnancy is detected. Drugs that act directly on the renin-angiotensin system, RAS, can cause injury or death to the developing fetus. Do not breastfeed and take Entresto. Warnings and precautions. May cause angioedema. Discontinue immediately and do not re-administer if angioedema occurs. Correct volume or salt depletion prior to therapy or start at a lower dose. If hypotension occurs, consider dose adjustment of diuretics, concomitant antihypertensive drugs, and treatment of other causes of hypotension. If hypotension persists despite such measures, reduce the dosage or temporarily discontinue therapy. Decreased renal function may occur. Caution with patients whose renal function depends upon the activity of RAS. That would be seen in severe CHF patients. Closely monitor serum creatinine levels and down titrate or interrupt therapy in patients who develop a clinically significant decrease in renal function. May increase blood urea and serum creatinine levels in patients with bilateral or unilateral renal artery stenosis. Hyperkalemia may occur. Dosage reduction or interruption may be required. Drug interactions. Avoid use with an ARB. Avoid use with allocersin and in patients with renal impairment with a GFR less than 60. Concomitant use of potassium-sparing diuretics, potassium supplements, or salt and substitutes containing potassium may increase serum potassium levels. Concomitant use of NSAIDs, including COX-2 inhibitors, may result in worsening of renal function, including possible acute renal failure in patients who are elderly, volume depleted, or with compromised renal function. Monitor renal function periodically. Drug interactions also include Entresto increases in lithium levels and lithium toxicity reported during concomitant administration with ARBs. Monitor serum lithium levels during concomitant use. Entresto may cause serious adverse reactions, including angioedema that may cause trouble breathing and can lead to death. Get emergency medical help right away if you have symptoms of angioedema or trouble breathing. Do not take Entresto again if you have had angioedema while taking Entresto. People who are Black or who have had angioedema and take Entresto may have a higher risk of angioedema. Low blood pressure, such as hypotension. Call your doctor if you become dizzy or lightheaded or you develop extreme fatigue. Kidney problems. Increased amount of potassium in your blood. The most common side effects were low blood pressure, high potassium, cough, dizziness, and kidney problems. How is Entresto supplied and stored? Entresto is available as unscored, ovuloid, biconvex, film-coated tablets containing 24 milligrams of sacubitril and 26 milligrams of valsartan, 49 milligrams of sacubitril and 51 milligrams of valsartan, 97 milligrams of sacubitril and 103 milligrams of valsartan. All strengths are packaged in bottles in unit dose blister packages, 10 strips of 10 tablets.